How to use iridology to treat mucus. I'll repeat that. How to use iridology to treat mucus. That's a fascinating question. Every year, I observe people suffering very badly from hay fever. You can tell they're suffering because the TV is replete with selling chemical formulation for hay fever, asthma, colds, flu. Every year, they make a lot of money by treating or trying to treat people who are sick with the respiratory system. That's what it is. So, let me explain what we're talking about here. This is what we call, it's a simplified version of the respiratory system. Now remember, there's 11 body systems. That's one of the most important because you respire, you breathe. If you stop breathing for 4 or 5 minutes, you're as good as dead, right? You're in big trouble. So respiratory system is a very important system to clear, so that you're totally clear of mucus. Now, it is known as mucus or phlegm, P-H-L-E-G-H-M, phlegm, right? And it's that viscous, yellow phlegm, green phlegm, bluish green that comes out of your nose and to your mouth, especially in the morning, right? That's what we call mucus. Now, how does it work? Fascinating. There's your nasal cavity here, goes in, and then here you have the bronchial tube right there, bronchial tube, which goes to the right lung, and then left lung. Now the lungs is much bigger than that. Much bigger than that. The lungs actually come from here, just the collarbone to the last rib. So there's your last rib here. Look at the size of that. See, look at that. That's the size of your right lung. Look at it, from here to here. And that's the size of your left lung. So it's a massive organ. So this is a simplified version, but it's certainly bigger than that, right? It probably goes to as far as that and as far as that. So it goes underneath the collarbone here, and the last rib here, that's the size of the lungs. Now, the problem you've got is this. When you're drinking milk, cow's milk, which has been treated with hormone, cow's milk, cow's cheese, heavy-duty bread, white rice, all the wrong, poor nutrition foods, you will build up mucus. The body will build up mucus. The mucus is like a prevention to irritation. So when you're irritated inside your body, the body creates mucus, creates phlegm to try and calm things down. But then the problem is you get excess mucus, excess phlegm, and that's when you get asthma. That's when you get bronchial tube blockage. That's when you get problem with breathing difficulties. You can't sleep properly because your nose is blocked. So there is a very, very good way to solve that out. So I'm going to show you by using iridology how we can then determine how much mucus is in the patient's lungs. For example, in this eye there, that's the left eye. Okay, so the lungs will be here. The lungs are here. Now you can see from here to here is the lungs. You can see the yellow there. You can see the weakness in the lungs. These are all broken up. These are lungs. There's 3 lacunas there called holes. The yellow there, that area there determines the length and quality of the lungs. You can see there's tremendous amount of weakness in the lungs here, and then this is the bronchial tube. Lungs here, lots of mucus, lots of phlegm, lots of weaknesses, and the bronchial tube's got very heavy phlegm inside there. That's the bronchial tube that feeds the air into your lungs. So the eye, to iridology, can determine and be very, very accurate in recommending by finding out how much mucus you've actually got inside your body. And the mucus can be as much as a kilo. Imagine having a kilo of your mucus in your lungs. You're going to get hay fever. You're going to get asthma, right? You need to have excess. There is normally a small amount of mucus, which is normal. But when you get excess mucus, that can give you colds, flu, hay fever, asthma, inability to run, inability to jog. Even when you walk, you're out of breath, right? So you need your lungs to be incredibly clear of excess mucus. By using iridology, we can find even the level of mucus you're at and the level of disease you're at, respiratory-wise. It could be asthma, could be any one of those. Now, if you like what you're seeing in this video, subscribe to it. And I want to continue now to explain something else. If you're suffering from mucus, and then the morning you wake up and you're spitting mucus out, come and see somebody like us. And then we'll check your eyes out, we'll check the amount of mucus you've got in your body, and we will recommend the herbs, the supplements, and the foods, and the life techniques you need to do to achieve absolute removal of mucus, excess mucus from your body. It is normal to have a little bit of mucus, but not excess mucus. Now, why am I successful in saying that? For the last 35 years, right, I have never had a cold or flu or asthma of hay fever. Nothing. Right? The odd bit of sinus running maybe in cold weather, but that's about it. But at my age, it's extraordinary. Most people at my age, 70 plus, they've got asthma, they've got hay fever, they've got colds, they've got flu. Every season they get the flu up to 4 or 5 times. Not me. 35 years, nothing. So if you want to get rid of mucus in your lungs, come and see us, subscribe to the channel, and learn a hell of a lot more about getting your health back in order.